Hi guys, welcome back to my channel. Are you pregnant? Are you considering pregnancy? Have you been physically fit and you just discovered you're pregnant and you're wondering what next? Then this is a video just for you. My name is Dr. Key. I'm a medical doctor by profession, and all things health and fitness is my passion. If this is your first time in my channel, please consider subscribing. If you're coming back, I love you guys. Keep watching. So, one of the main requests is from women who just discover that they're pregnant or are considering pregnancy, and they're wondering how much of physical activity can I engage in without imposing a risk to my unborn baby. And I know this is a major concern to most of us. Even as a medical doctor, I know many of my colleagues that are not sure what level of advice to give to their patients when they are managing them with pregnancy. So I am going to provide a bit of clarification around that. So what are the 5 tips that you should remember if you want to engage in fitness while you're pregnant? Tip number 1, get cleared by your doctor. Your first visit with your OBGY, they are going to do a history exam, they are going to do a physical exam, they are going to do some lab tests, they are going to do some imaging work that is going to determine whether your pregnancy is high risk or non-high risk, or whether any form of a high physical activity in terms of intensity is going to have an impact on your pregnancy. So tip number 1, get cleared by your doctor. Have an initial checkup, and if you're good to go, then tip number 2. Tip number 2, remember, pregnancy is not a time to develop new fitness goals. No guys, it's a time to maintain or to begin a sustainable, a realistic fitness goal. Remember, the American obstetric colleagues all agree, in fact all obstetricians, all medics, all agree that and recommend that being physically active while you're pregnant is good for you and it's good for your baby. And they recommend at least 30 minutes of moderate intensity physical fitness at least 3 to 5 days in a week. So guys, it is a recommendation now, it's not a suggestion. If you're pregnant, it's not a time to just sit back, load up on all the unhealthy foods and then wait for delivery. It's a time to be physically active in the house, take a walk, moderate intensity guys. Tip number 3, what activities can you engage in? As I said, it's moderate intensity. How do you measure moderate intensity? Do what we call the talk test. You should be able to talk during your workouts. If you're jogging, if you're doing any interval training in the house, if you're taking a brisk walk, remember, do the talk test. Okay, I know you cannot talk if you're taking something like swimming, but for the rest, try and talk through it. If you can talk through it, then you're sure that you're doing moderate intensity workouts, and this can include walking, jogging, brisk walks, yoga. If you've been physically active through your pregnancy, remember, you do not have to change your level of intensity in the first trimester. So that's up to around 14 weeks. You can basically continue with the level of intensity that you were having before you were pregnant. From 2nd trimester and onwards, then remember to do pregnancy modification. Tip number 4, remember, you will still gain weight. Even if you work out during your pregnancy, weight gain is going to be there because you're building a new living thing in your body. You're actually housing a very important project in your body. There's going to be the baby forming, there's going to be the amniotic fluid, the fluid covering the baby. Your body is going to make all the the relevant adaptations to ensure that the life that you're carrying is safe and that you carry it to term. So please do not be afraid of weight gain. Please check out the pregnancy weight calculators online to see the range of weight that you should be sticking with all through. It's basically based on your pre-pregnancy metrics, and it helps you to know whether you're gaining too much weight during your pregnancy or you're basically gaining too little weight as per the recommendations. The good thing about weight gain in pregnancy and remaining physically active is the fact that once you deliver, it gets so easy to lose your pregnancy weight and go back to your pre-pregnancy weight. With my 2 pregnancies, I was able by 7 months to go back to my pre-pregnancy weight because I remained physically active all through my pregnancies. Then tip number 5, and I cannot emphasize this enough, guys, safety first. That is why my tip number 1 was get cleared by your doctor before you engage in any form of physical activity while you're pregnant. Then, while still remaining safe while you're working out, work out in a well aerated room or choose outdoors, open the windows, wear loose fitting clothes, ensure that you have your water to always drink and to stay hydrated as you work out. Remember to maintain good form. When you're pregnant, remember your body, especially the joints, become loose, and what happens is that you are highly prone to getting injured while you're working out. So maintain good form while working out. Avoid any physical activity that involves you jumping and increases your risk of falling. So your moderate intensity, make sure it's none of the things. Ski jumping, any jumping activity that risks you falling is not good for you. Then remember, from the 2nd trimester, there are some modifications you should add into your workouts to ensure that you're not harming the baby or harming yourself. So one of them is after 1st trimester into your 2nd trimester, any workout that involves you lying back with your face facing upwards is not encouraged. The reason is because as your uterus grows, then it lies on one of the very important vessels, and this can decrease the blood flow to the baby and also make you feel dizzy. So as always, avoid any workout that involves you lying supine with your back flat and your face facing up. Then remember, planks or any moves that are in a plank move are not advised. Core strength during pregnancy is encouraged, but there are modifications. Please check out YouTube on how to do those modifications while you're pregnant. Then remember, should you notice that you're having a severe headache, you're feeling dizzy, you are bleeding vaginally, your amniotic fluid, your liquor starts dripping, or you cannot feel your baby kick as well as you used to feel before, please make sure that you do not continue any further physical activities and make sure that you see your doctor. Safety first. Fitness does not increase your chances of harming your baby. In fact, it's good for you and it's good for your baby. I hope this has been an informative video for you. Please share with your friends. Enjoy your pregnancy journey. It's such a beautiful journey, guys. Thank you and bye bye.